cochlear nerve. Moving on to the cranial nerve number 9, glossopharyngeal nerve. It's a very big nerve in terms of the types of fibers. It has a lot of types of fibers. It has special visceral efferent fibers, the motor ones, the parasympathetic fibers, general visceral efferent. Sensory fibers include both general visceral afferent and special visceral afferent, and general somatic afferent also. Let us talk about the nuclei. Nucleus ambiguous. It's the one that is responsible for giving it's the motor supply, that is the special visceral efferent component. It has only one muscle that it will supply, and that comes in the exams very frequently, stylopharyngeus. Then there is parasympathetic output, that is only one parasympathetic nucleus, that is called general visceral efferent, and this will go and supply the parotid gland. That's the point to remember. And it has further multiple inputs. It The inferior salivatory nucleus will have descending atomic fiber that will make you salivate when you think of something tasty. There is fibers from solitary nucleus that will salivate reflexly when your tongue touches something tasty. And there will be, of course, from the reticular formation that are shown right here. Actually, reticular formation that leads you to salivate when you smell something tasty. So these are its connections. I will discuss its pathway later on. We talked about special visceral efferent. We talked about general visceral efferent. Now time to talk about the special visceral afferent, taste fibers. Taste fibers are going to end in nucleus of tractus solitarius, or in otherwise known as solitary nucleus. And a very brief discussion on the ascending pathway. This is the nucleus shown here. This will be the second order neuron. First order neuron will be the ganglion of the glossopharyngeal nucleus. There is superior and inferior ganglions. This will be the first order neuron. Second order will be this. The second will cross the midline. It will move up. It will relay in the thalamus, and it will go to the brain. The same formula as for the spinal tract. And then there is spinal nucleus. This contains both the general visceral afferents and special visceral afferents. The general visceral afferents, they get signals from the carotid body and carotid sinus. Taste fibers, they go to the special visceral afferents. And then we are left with these. There are some areas like common sensation, especially around the ear and the middle ear. Those general sensations are carried to that. So these are the 5 types of fibers that are present in the glossopharyngeal nerve. And if you did understand that, congratulations to you, that these are the same nuclei and the fibers that we will discuss again in the vagus nerve. So let us look at it. It is exiting between the olive and the inferior cerebral peduncle, most superior one. It exits through the jugular foramen from the cranial cavity. It has ganglion present there. Superior and inferior ganglion are present there. Here the dorsal root, the cell bodies are of the sensory fibers are there. It moves down in the neck with the internal carotid artery and the jugular vein in the carotid sinus. Then it moves between the superior constrictor and the inferior constrictor near the stylohyoid muscle to enter the pharynx, and it goes on to supply then the tonsillar bed and the back of the tongue and the other areas nearby. That's its general course. The branches that include are the tympanic branch. It's a very complex branch, and complex pathways there. That is the branch that is given near the inferior geniculate ganglion. The branch exits, it enters the middle ear. The branch that is going in the middle ear, that is the inferior geniculate ganglion, the branch that is entering the middle ear is the tympanic nerve and enters the middle ear. In the middle ear, there is a plexus that is formed in the promontory, that is tympanic plexus. It moves through that and it exits the middle ear as lesser petrosal nerve. It exits into the middle cranial fossa. In the middle cranial fossa, it runs, it moves down through the foramen ovale, and it reaches this otic ganglion. Here you can see the solid line converting into dotted line. Here the preganglionic parasympathetic fiber relay with the postsynaptic cell body. Here it relays, and from there onwards, postsynaptic, postganglionic fibers, they move on. Then they go through the auriculotemporal nerve. Again, a reminder that auriculotemporal nerve hugs the middle meningeal artery and it moves all the way and supply the parotid gland. We discussed the path of this auriculotemporal nerve in the lecture earlier in the lecture today when talking about the trigeminal nerve. Now, this is the auriculotemporal nerve, the parotid gland. These things are shown here in this picture. You can see it right here. Dorsal nerve moving down and getting into the. Don't worry with that. Schematic diagram would be enough for you. Let's talk about the other branches. Then there is branches to the carotid sinus and carotid body. The sinus is the one that detects the changes in pressure, the baroreceptor changes, and carotid body is the one that detects the changes in the chemical, that is the hypercapnia, hypocapnia. So it moves between the nerves. It gives rise to the branches to the carotid sinus and carotid body. Here is the sinus and body shown here. Carotid sinus is the dilatation and carotid body is an independent organ. Okay, then it has only one muscle, and that is the nerve to the stylopharyngeus. That is the nerve shown here, and that is the muscle that is highlighted as yellow orange. That is the stylopharyngeus muscle. And then there is a branches to the pharyngeal plexus. Pharyngeal plexus go back. Then there is the lingual branches that go to the tongue, posterior one third of the tongue, and then there is a tonsillar branches, and it can shown to supply the area around the palatine tonsils. So these are the branches. Let us see as the same thing in the Netter's atlas. These are the same thing that are shown here. The different origin nuclei are shown. The two ganglions, the sensory ganglions. This is the pathway that is going to the ear, the tympanic plexus, then the lesser petrosal, otic ganglion, auriculotemporal nerve, parotid gland. Same story. Then it moves down and it is going down to show the stylopharyngeus motor splice shown here. The branch to the carotid sinus and carotid body shown here. The sensory branches to the pharyngeal plexus that gives supply to the sensory supply to the oropharynx is shown. And then there is supply to the posterior one third of the tongue, journal and taste sensations, and the supply to the sensory supply to the area of the tonsillar fossa. That's the glossopharyngeal nerve for you. Talked about nuclei, cores, branches. These are all the things we just talked about. The glossopharyngeal nerve lesion leads to the paralysis of only one muscle, that is the stylopharyngeus muscle. It's a one menial small muscle. The paralysis of that muscle does not lead to anything significant happening. The significant happening that occurs is due to the loss of the sensory component. You do not feel the taste sensation in the posterior one third of the tongue. You cannot feel the sensation in the pharynx, oropharynx. The important part is that the gag reflex does not work anymore. The gag reflex is the one when any nauseous, when any unwanted stimulus is given to the posterior wall of the pharynx, the glossopharyngeal picks up the sensory fibers and it circles back through the vagus nerve, and the the pharynx contracts, the gags. You push the unwanted thing out of your pharynx. So it does not, gag reflex does not function anymore. It is originating near the vagus. It has all the nuclei shared with the vagus. Its pathway is very near to the vagus. It is usually injured with the vagus.